So there are 3 variations of chest compressions. One is the one-handed technique, which is directly over the heart of the smaller dogs or cats. So you find the heart and you do your chest compressions with one hand if it was a small dog or a cat. Next is the two-handed technique, which is directly over the heart in lateral direction for the heel-chested dogs, which this dog is. So you would take your hand directly over the heart, up on the stool, lock your elbows, and use your core muscles and do your compressions for 2 minutes while another person is giving the breaths to the dog. Do that for 2 minutes, and then you and the breather will switch positions, and the person that was doing the breathing for the animal will come over, take your spot, and you will go to the breathing bag and breathe for the animal. That helps to avoid fatigue for all the people involved in the CPR patient. The next is the two-handed technique on the sternum over the heart and dorsal recumbency for barrel-chested dogs such as bulldogs. So if this was a barrel-chested dog, you would turn him over, two-handed technique over the heart on the sternum, or the barrel-chested dog. Team leaders should have the compressor switch every 2 minutes and compress the chest a third to a half width of full recoil of the chest. Don't keep pressing on it because it doesn't allow the chest to recoil. So you would press and do your compression, lift up a little bit, compression, up a little bit. This allows for recoil of the chest. To begin the CPR, the most important, like I said, is the compression, then the airway access, and then the main access for any drugs that may need to be used. When changing your compressors, the team leader should evaluate the heart rhythm, the ECG, to determine if the patient needs any vasopressors, vagolytics, antiarrhythmic drugs, and if needed, any defibrillations. Intubation and lateral recumbency for 100% O2 oxygenation. Breath every 10 seconds. So you would count every 10 seconds as the intubation endotracheal tube would be hooked up. You would go no more than 20 for the breath, as anything over that would expand the lungs too far. You would hold this and then breathe for the patient, let go, count 10 seconds, again, let go, and count another 10 seconds, and so on. The song Staying Alive helps with correct compression rates. Don't lean on the chest during compressions, as it doesn't allow, like I said, for the full recoil. Put the hands between the compressions. Maintain the lax elbows so that you use your core. Sometimes epi and heparin are the most used drugs during CPR. Also, epi is a vasopressor. Vasopressin increases the tone of the peripheral vessels and redirects the blood to the brain and the heart. Vagolytics, which is atropine, parasympathetic blockers, prevent and treat tachycardia. Antiarrhythmics, lidocaine, aminodarone, I'm not saying that right, I know I'm not, treats abnormal heart rate rhythms such as ventricular fibrillation and ventricular tachycardia, and it's resistant to electrical defibrillation. In smaller patients, to end this video, if there's unsuccessful vein access, you can do an IO catheter, which is an intraosseous catheter mostly used in the exotics, smaller animals, and pediatrics because they have smaller veins.